Today, we're tackling a critical topic, obesity and its impact on our adolescents. Joining me is the incredible Dr. Asma Deeb, consultant and chief of Pediatric Endocrinology at Sheikh Shakhbout Medical City Hospital in Abu Dhabi. She's also a clinical professor at Gulf and Khalifa Universities in the UAE. Hi, Dr. Asma, how are you?
Good, thank you.
Thank you for being with us today. So let's dive right in. We see more and more adolescents now struggling with weight. Now, what are the current trends that are in terms of the prevalence of adolescents struggling with weight gain? Tell us a little bit about that.
Sure. First of all, thank you very much indeed for inviting me. It's always great to tackle such epidemics of chronic diseases like obesity. Current trends are really alarming at the moment, I'm afraid to say. And obesity is currently, particularly in children and adolescents, has reached epidemic levels. So we're talking about a global disease. So talking about people living with obesity and particularly children and adolescents, the numbers has become incredibly high. And unfortunately, we continue to see the rise in that. According to the World Obesity Atlas of 2023, statistics shows us that there are at least 175 millions of people of that population living with obesity. And there's no area in the world that's exempt from obesity. So talking specifically about the Arab world, the Gulf and UAE specifically, there are some data showing that the risk of having obesity in people living in this area is at least 2 or 3 folds.
Okay.
I've seen some statistics from WHO, the World Health Organization, showing that percentages of children and adolescents living with obesity in UAE has reached numbers of around 38%. Used to be 25% a decade ago. Now it's around 38%. And people are predicting that to come up to 50%.
Wow. Those are alarming numbers. I want to go into what are the reasons that people are, suffering from obesity at such a young age? Because those numbers are not very, they're not normal. No. They're very concerning, for sure.
I can't agree more. Talking about reasons for that, I wish if it is simple and can be answered in short words. Obesity is a chronic disease, so we're not talking about a phenotype or a phenomenon that we are describing. It's a chronic disease, and it's not that it's a disease that you can highlight the underlying factor. It's a complex disease and a multitude of factors that interplay together to give us the features that we see. In addition to the straightforward answer of people having imbalance between the caloric intake and the expenditure, there are multiple other complex factors, including genetics, endocrine, and so many other factors. But what I would like to highlight specifically here is the impact of the obesogenic environment.
Okay.
And by that, I mean the factors leading to disturbance of the healthy lifestyle.
What does that mean exactly?
Exactly. So when we go or when we dive deeper, like you said, into the component of healthy lifestyle, we will go to exercise and food intake. And when you dissect those further, so if you talk about exercise, children and adolescents nowadays are moving away, unfortunately, for multiple reasons, away from physical exercise. And they tend to be attracted more to mental ones. So you find people loving electronic gadgets and they are getting very smart in electronics. And this led to people moving away from moving their bodies and turning into easier stuff, perhaps more enjoyable according to them, and increasing screen time.
So, can you list us some of the common diseases or some chronic diseases that may be linked with obesity in adolescents?
Yeah, this is a very important question. Thank you for asking. I really hate to say, but obesity comes with a package of other comorbidities, and without any exaggeration, you pick any system in the body and it will be affected by obesity. I'll give you some examples for adolescents. So, a female adolescent who lives with obesity will have, or at a higher risk of having, psychological issues and mental illness, and we talked about that. But also very commonly we see in clinic disturbances of menstrual cycle. For example, polycystic ovarian disease. Girls who come with features of hirsutism, for example, so they have abnormal hair growing in their face and the chest, and they have those features that lead to reduction of their self-esteem because they lose their hair and they get hair growth in other areas, and this makes their self-esteem really low, in addition to other diseases of adults like osteoarthritis, high blood pressure, high level of cholesterol, and many others.
So, since this is such a sensitive topic, how do you recommend that parents approach this topic to their teenagers, to their adolescent kids, in a sensitive way where that the child does not feel shame, or that they don't want to retract from a conversation? Are there any icebreakers, anything that the parents can come with so that the child may accept when you tell them, listen, you are, becoming obese, or we need to take you to a doctor? How can parents approach this topic?
Yeah, I'm glad you asked that, because management of obesity must be family-centric. And if the issue is not tackled through parents and the family members as a whole, any treatment is not going to be effective. So family members being mother, father, siblings, or close relatives need to be supportive to each other. Empowerment is important, and encouragement of the right approach is very important. So education is very important about things of adapting healthy lifestyle. People know that. Nowadays, I must admit that education is not the main issue, because people know and exposure to knowledge is there. However, communication skills between family members is important, support, as well as tackling behavior. We ran exercise, I remember, for a group of adolescents in our clinic, asking them which food category is more healthy than others. And people know this. Adolescents nowadays are very smart, but we need to help them acknowledge that this is a disease. We need to avoid pointing finger, using abusive words, and encourage them to understand that we can work together to tackle this issue that's not confined to them. This is a global issue and it's everywhere. So they need to be explained what the issue is, and they need to be completely not judged and prompted and offered help to understand and to work together, basically, in a healthy manner. And as I said, a family-centric approach, so that it's a win-win for everybody within the family as well as within the unit of the healthcare professionals.
Everything starts with a family unit, right?
Can't agree more.
Thank you very much. Thank you. How can obesity in young people be linked to depression and anxiety? Are they linked in any way?
This is a very important point, Yasmin. Thank you very much for highlighting. And so this chronic disease is interesting in the sense that it has a lot of psychological and mental health issues interplaying with the actual organic disease. So like you said, there's a close connection between depression leading to obesity, obesity leading to depression, so more of a vicious cycle. So we see those children and adolescents being pointed at, stigmatized, bullied, judged. And a recent study I read about the quality of life of children living with obesity, and they score actually and surprisingly much lower than other adolescents who have diabetes, for example, or who have even cancer or rheumatic diseases.
Is it because, body image issues comes into play and the bullying? Is that, can we...
That's a huge part of it.
Yeah.
There's the psychology part and there's the comorbidity part as well. So these youngsters, they cannot even, some of them, when they reach high level of obesity, they have obstructive sleep apnea. I know of children who I see in clinic, they cannot lay flat to sleep. Right. So they sleep sitting up, and you can imagine the quality of life. Yeah. But it's dysmorphia.
So I was just I want to go into that a little bit more. Can you name maybe 3 emotional problems that young people would be suffering from that would lead them to obesity, such as what we just discussed, the body image issues, if you can say in your own words?
Yeah, I think if you're talking about the psychology and mental health, there's an extensive list of what they have eating disorders, they have binge eating, they have body dysmorphia, they have low self-esteem, and you name it. Not only that, but they can go into actually clinical depression. Not only depressive symptoms that you can softly feel that they have, but if you score them or you look at them properly by experts of psychiatry, a good percentage of them, they score high. They can easily be diagnosed with clinical depression.
And like you said, it's a cycle. It's a vicious cycle, right? It's a tough cycle to break. And I feel like, one thing leads to another. So if someone suffered a little bit of body image issues and they're being teased for that, then they're going to start eating more, and that will lead to obesity.
Correct.
So what are some, we've spoken about the problems. What are some of the solutions that parents can really pay attention to and start implementing for their children, so that they can avoid cycles that lead to obesity?
Okay, well, thank you again for asking this question. And I would like to raise an important point about this specific population, talking about adolescent and children, and specifically from the age of 12 to 19. That's the definition of adolescent by the definition of WHO. So for this particular age group, there are nowadays multiple pharmaceutical medications that are approved. They're safe, they're effective, and they can be used for this particular age group.
Is there anything else you would like to add about this that maybe parents and adolescents who are watching can really benefit from?
Yeah, I think a short message to people who live with obesity: they need to come out, open up, and speak to people, because obesity is not a fault of anybody.
Yeah,
it is a disease. People should or could or have people around to help, to guide them. And nowadays, I'm very pleased to say that there are medications and pharmacotherapeutic agents that are safe and effective. Okay. They are approved by big institutions, and if they are taken according to the instructions of specialized centers, these agents can definitely be helpful.
Great.
And one last point is, people shouldn't be ashamed of having obesity. It's a disease. And for us, healthcare professionals should avoid judging people, shaming them, but guide them to where the treatments are.
I think that's a very important point to make. And thank you so much for making it. And thank you for being with us today, Dr. Deeb. I really, really hope that parents and adolescents find this useful, and they'll be, taking it with them to school and in the future.
Thank you very much indeed.
Thank you.
Thank you.
This podcast is sponsored by Novo Nordisk. Since we are approaching the end of this episode, Novo Nordisk has created an online HCP locator website to support patients living with obesity to locate the nearest physician according to specialty. And I encourage all healthcare professionals to have open conversations with adolescents living with obesity and their parents proactively.